My name is Misty Spitaleri, and this is my 2016 Capstone project, Developing and Implementing the Universal Electronic Health Record System. The purpose of this project is to discuss the benefits of developing and implementing a universal electronic health record system whose interoperability will help reduce healthcare costs, improve patient care and participation, reduce errors, and create a more efficient. Some of the earliest forms of medical records can be traced back to modern England in the early 1600s. The most extensive collection of detailed cases were headed with a name, date, complaint, then list a history, diagnosis, therapy, and payment. Prior to the 1920s, the United States medical recording practices and standards were inadequate. The health information management industry really took root in 1928 when the American College of Surgeons established what is now known as the American Health Information Management Association. The AHIMA is still one of the leaders in the effective management of health data and medical records. Near the end of the 60s, Dr. Lawrence Weed first acknowledged the need for a problem list and described the problem-oriented medical record, or POMR. The POMR created a single location to store all pertinent data pertaining to a patient's care. Dr. Weed's technique then allowed a third party to analyze the data and either verify. These advances in medical recording were monumental, but were only truly useful if the patient's care was centrally located to one physician or organization. As computer technology advanced and became more commonplace in the late 70s and early 80s, it was a natural progression for health information management to begin pairing the medical record with computer technology. It wasn't until the late 90s, when medical errors were becoming commonplace and deaths were being caused by inadequate health care, that the industry took a hard look at developing a true electronic health record system. In his 2004 State of the Union address, President George W. Bush called for an electronic solution, stating, "By computerizing health records, we can avoid dangerous medical mistakes, reduce costs, and improve care." Finally, after many years, with the passage of the American Recovery and Reinvestment Act in 2009, use of electronic health records was being required. It has been a very slow progression of advancement spanning almost 100 years of time, and while the industry has made great strides, it has yet had a significant. As of 2014, the national health expenditure for the United States had grown 5.3% to $3 trillion and accounted for 17.5% of the GDP. The Centers for Medicare and Medicaid Services projects that health spending will grow at an average rate of 5.8% per year, reaching more than 20% of the GDP by 2025. The implementation and requirement of adoption of an EHR system has done little to decrease spending in healthcare. On top of that, many physicians are unhappy with the current EHR system, thanks in large part to cumbersome processes and limited features that get in the way of patient care. In an effort to modernize our nation's infrastructure, the Health Information Technology for Economic and Clinical Health, HITECH, supports the use of an EHR system and proposes the Meaningful Use Initiative. Meaningful Use is an attempt to encourage hospitals and other healthcare organizations to adopt the EHR system. Those hospitals and healthcare professionals who are eligible and have demonstrated an effort to incorporate a certified EHR system are awarded an incentive payment. Fortunately, because of the poor quality of some of these systems and the lack of interoperability and data exchange, the insistence of use by the government has done little to reduce the cost of health. To the average person, the EHR is a fairly new concept in the world of medicine. In reality, doctors and scholars have been writing about an electronic solution to medical records for decades. References can be found as early as 1968, when Dr. Lawrence Weed was writing about the importance of computers in medicine and creating a more organized approach to the medical record. It is common for authors who discuss the implementation of an EHR system to reference the potential such as quality of care, improved safety, greater efficiency, more cost-effective, and improved doctor-patient relationships. Equally and probably more common are the issues found when implementing an EHR system. Authors found users to find the current EHR systems challenging and cumbersome. They lack usability, or already preconceived biases stand in the way. Some authors suggest the use of super users is a good way to foster the successful implementation of EHR. Usually, healthcare organizations will pick individuals employed and will give them intensive training, and then once the chosen EHR system is implemented, These super users will be available to guide the rest of the staff and act as ambassadors that help foster acceptance. Those individuals that are excited about what they are doing have a greater chance of success. The United States is not the only country who has required implementation of EHR systems. England acquired 3 commercial EHR systems and set out to implement them in over 200 hospitals. The implementation process was nationally led with the main focus on interoperability. A study found several problems developed from lack of customability, resistance of users, and members of the team were changing the way they interacted. Patients weren't getting the time they were accustomed to, medical records were less than accurate, and medical reports that the managers needed to generate weren't reliable. One article states that the meaningful use incentives will create better patient engagement and culturally competent healthcare. An EHR system gives patients a platform to actively engage in their healthcare. This is exceptionally important in addressing sociocultural differences where communication between the patient and the provider is not adequate, which can lead to poorer health outcomes. Research has been done on the effects of meaningful use in local health departments. Local health departments are typically run by registered nurses who are unable to qualify for meaningful use incentives. They are common institutions for individuals with no health coverage to receive medical care. EHR systems are still proving to be beneficial for local health departments in their ability to provide relevant patient data quicker and improved patient health outcomes. Developing one universal EHR system is an enormous undertaking, and something of that magnitude will require the funds, resources, and reach that only the government can provide. Currently, under meaningful use, there are several EHR systems to choose from. Having so many systems continues to reduce those chances of interoperability that can only truly be achieved by a single universal EHR system. While the ARRA has created universal criteria for various systems, the government must now also create a single system with uniformity that facilitates cross-country interoperability. Creating a universal EHR system that facilitates the needs of the various users across the healthcare industry will require a task force that represents each interested party. It must be created to allow different levels of accessibility pertinent to the type and needs of the user. The universal EHR system needs to follow all legal and regulatory requirements of state and federal mandates. Once the system is developed, an implementation plan must be put in place. Realistically, a mass release is not plausible. It will require a gradual process with dates released to various markets until every member of the healthcare industry across the United States is using the same system. Prior to its release, system requirements will be established and training workshops and modules will be developed. More than likely, the new system will require the organization to purchase the new hardware. Every employee in the organization will need to be trained on the new system since it will encompass the entire operation of the organization. Once implementation is complete and the EHR system is active, additional training may be required through the years as updates and system changes occur. People in general are not a fan of change. There are several purposes behind the generation of a universal EHR system, all of which have the potential to create benefits for all involved. Benefits to the healthcare organizations include improved medical practice management by increasing practice efficiency, cost savings, and an enormous amount of time can be saved communicating with patients, other caregivers, consulting physicians, and specialists through electronic means rather than phone conversations. An EHR system gives physicians the tools to improve both the efficiency and quality of patient care. Notes can be entered into the file as the physician is speaking with the patient, freeing up time that was once spent dictating notes into a recorder. EHRs give physicians the ability to share and receive patient information instantaneously, which can prove to be invaluable. Out of all the parties involved, patients receive the greatest benefits of all. The implementation of a universal EHR system increased the quality of patient care by focusing on patient safety, effectiveness, and efficiency. Patients are receiving results faster and able to start treatment quicker. Direct line has been created between the patient and their providers, allowing more accessibility to their physician. An EHR system allows patients. With the implementation of a universal EHR system, the healthcare industry that we know today can be forever changed for the better. A system that allows complete interoperability across the country and grants access to a patient's record from anywhere in the world can change the scope of our healthcare delivery system. Instituting an EHR system opens the doors for other electronic or e-health opportunities. Taking advantage of the opportunities that a universal EHR system opens up for the healthcare industry makes room for increased efficiency in healthcare, improved quality of care, increased commitment to evidence-based medicine, empowerment of patients and consumers, and the development of new relationships between patients and health professionals. Digital technology is increasing efficiency in nearly every industry we know. The development and use of the universal EHR system finally allows the healthcare industry to utilize all that the digital world has to offer and provide care that is cost-effective, efficient, and timely. Encompassing an electronic means of record keeping will transform the way we deliver care and allow information to be available whenever and wherever it is needed. Essentially, this project, if realized, would mean an enormous amount of political and social barriers. The government began discussing healthcare reform in the early part of the 1900s, and we have yet come up with a healthcare reform policy that pleases the majority of government or the people of the country for that matter. Implementing a universal EHR system will most undoubtedly face some of the same obstacles as a universal health system faces. Developing this type of system requires an enormous amount of research in the form of safety and security measures. Prior to its implementation, the populace is going to want to guarantee that their information is secure. Being able to develop a system with security measures that can garner this degree of safety certainly will require extensive research and planning. Realistically, undertaking such a large project would cost the government millions, if not billions, of dollars. As of 2014, the website that runs the Affordable Care Act health insurance program had cost the government in excess of $2 billion. It can be surmised that a universal EHR system would cost every bit as much and most likely more. One key benefit of a universal EHR system is the reduction of healthcare costs. One study indicated that the implementation of a system could save up to $81 billion in healthcare costs annually. But how long will it take for the benefits of an EHR system to outweigh the deficits caused? Research in developing and implementing a government-run universal EHR system is a massive undertaking. There are so many variables from government legalities, funding, and resistance to the idea to security issues and trust issues which require further research. There are a vast amount of benefits that can be realized with the implementation of this type of system, but the scope of time, money, and government regulation could greatly hinder the development effort. This leaves us with the question, can and will the benefits imparted upon the industry outweigh the deficits that the construction of such a system will create?